Okay, and now I'm actually very privileged to invite our patient panel to come to the stage. So our four patients who have volunteered to come today, if you could come to the chairs. And while they're coming to the stage, just by way of brief background, most questions will be answered by probably just one of the panelists, and the audience can direct questions to a specific panelist or can let them pretty much decide, who's most appropriate to answer. And we've got an internet audience as well. So as I had mentioned, most questions will be answered by just one individual, but I'm going to break that rule to start with. And I'm going to ask at the very beginning for each individual to basically give just some background about themselves, their melanoma history to the extent they're comfortable doing so, and the current outcome. So I can either call names or actually it looks like Steve Carpenter. So you've got do you want to start? Or?
Sure.
Okay.
My name is Steve Carpenter. I first had melanoma in 2011 and met Dr. Albertini in that year, I believe. And as far as my career goes, I am a limnologist. I work on streams and lakes of Wisconsin. And do you want me to give my 3 points?
Sure. I mean, I think in the beginning, just to kind of both introduce yourself and as much as you are comfortable, your melanoma history and kind of where things are at now for you. So this is first for the audience to really understand who the panelists are and kind of what their melanoma background actually is. And then we'll come back to specific questions and points and stuff afterwards. So in terms of my first question is going to be advice, but save that. And for right now, I think just giving a brief background both about yourself, your melanoma history, and where things are at now.
Okay. I think the only thing I would add on melanoma history is that I have had surgeries. I have had I guess it's called interleukin-2. It's what was that called?
That was the immune checkpoint blockade therapy that you had. Yes.
Okay, but then I had something that I injected.
That was the interferon.
Interferon. Okay. I injected interferon into myself for about a year. And then I had a checkpoint inhibitor. There was a brain complication. So I had a sort of a space age, low energy radiation therapy that seems to have cleared it up.
Right. Okay. We just go in sequence. So you can just say your name and a brief background. So Ron, looks like you're next.
All right. My name is Ron Parker, nicknamed Buck. I do a lot of farming, everything, worked my entire life outside. And I had my first bout with melanoma in 2004 with a scoop, and I ended up having stage 2. And then that was at the VA, and then I ended up coming down to Madison. That's where I met Dr. Albertini in 2005. Had surgery to remove the tumor. And inch deep by, I don't know, 8 inches long and wide to my elbow. In 2008, I had another surgery in arm, another tumor showed up. Oh boy, it just kept progressing. I kept having surgeries, 2008, 2009. I had chemo pills, and then 2009 again. 2010, I had radiation. And then I ran out of everything over there at the VA for my melanoma. So then I came to the University of Madison where Dr. Albertini also was working. And then I started having surgeries there. And I did some clinical trials where they took blood out of a rabbit, took the 4 proteins out of that, and put it into the tumor. No results. I just kept getting sicker. And I ended up with 6 months to live. And then he came out with another, it ended up being epi. I took that in Eau Claire. And my personal belief is the two together fought the cancer. It was amazing. I just had it on my armpit, come right out, and you just watch it fold in and disappear. So now I've been cancer free for probably 12 years.
Kirsty.
Hi, everyone. My name is Kirsty Blattner. I'm a professional speaker and have 9 more weeks of being a grade 2 teacher. I had melanoma when I was 3 months pregnant in 2016, one of the few cancers that can transfer from mother to baby. So rather than the pregnancy glow, I had the pregnancy woe. But luckily she was fine. So good news there. It was stage 1. So surgery, it was on my right jaw line. Surgery got rid of it. And then I think about 4 years later, it came back in the same spot. So then we decided to give it a dose of radiation and immunotherapy for 1 year. And so far, so good.
Yeah.
Hello, I'm Kathy Stokoyak. I'd have to say I was a buyer and now I'm retired. Happily retired. My cancer started in November of 2017. I had a spot in my upper thigh. And I went to the surgeon, they did a biopsy and found out that it was melanoma. And then on December, I had surgery on my thigh. And then in December, I had a scan and it showed melanoma in my lymph nodes and on my leg and my lung. So I had surgery removing lymph nodes on my leg. They hit the spot again. And let's see, from there. Let's see, for my surgery, I have to really thank my family. Got me through a lot of tough days. My daughter nursed me back to health after my surgeries. She's right here. And I relied on them a lot to get better. Not knowing where I was going with this, you know, I guess I kind of walked in without, I don't want to say I don't want to care, but I, you know, kind of blind. So from there, Dr. Albertini, thank you, had me taking Keytruda. And we started out on 3 months of treatments. And then I had a scan and it showed that all of my cancer spots were dormant, small, non-changing. Wow. 3 treatments. I was amazed. I did have a couple side effects with Keytruda. I did have the rash. I had a rash from my head to my feet. Dr. Albertini had me take some cream. And I remember he putting in a prescription and I said, you know, make it a large jar, please, because I'm 5'9". I got a lot of body to cover. So I go to the pharmacy and he gives me these little tiny creams. I'm not kidding you. They were the size of my finger and I got 4 of them. And I looked at him and I go, really? What am I going to do with this? I said, doesn't this come in a vat? And he kind of looked at me and I thought, okay, so much for that humor. So anyway, just kind of a funny story. I also had some problems with the removal of my lymph nodes. I ended up with lymphedema in my leg. I tried many therapies, tried to massage it. Nothing really happened. Nothing really worked. So I kind of just got stuck with that. I do remember, since I have been going back for scans, everything has been just normal. But I do remember in 2021, I had a panic attack. I had this neck that just throbbed, and it was on my left side, which is where my cancer started. So I freaked. So on the phone to Dr. Albertini, and I'm like, oh my God, it's back. I know it's back. I just know it. And he talked me down my ledge, said, all right, calm down, calm down. And he said, it's probably just a muscle strain. Give it a couple of weeks. And yes, it went away. So
So amazing stories. We probably should go to the questions pretty soon, if that's okay.
sure.
Okay, so again, really four incredible people, four incredible stories. Let me just, actually, do one or two of you just want to answer the question? What advice would you give other patients?
Sure. Can you hear me? Oh, here we go. All right. I made 2 pages of single space notes when Dr. Albertini asked me that question, and I boiled it down to 3 things that I have told friends who had cancer of various kinds. First one is follow the treatment that's best for your chance of survival and your quality of life. And you're going to get advice on that from the experts at Carbone, Dr. Albertini, and in my case, but follow that treatment that looks best. And once you're in the treatment or the course of treatment, go all in. It's another job, and you just got to be there for yourself. Just go all in. So that would be point 1. Point 2 would be ask for help when you need it. The Dr. Albertini and other doctors there will help you out, and also the staff at a Carbone know an amazing amount. And just ask if you've got a question, and they'll help you understand what's going on. And the third point is keep doing what you think is important. Whatever parts of your job, your life are meaningful and important and worthwhile to you. And, those might be your work, your family, your hobbies, your outdoor recreation, your exercise, whatever is meaningful to you, just keep doing it, because that will help keep your morale and energy up. To deal with the disease, which is just another job. It's a management problem. You're working 2 jobs when you have cancer. You're managing the cancer, and you're managing the job or jobs that you had before.
Very thoughtful words. I'll let each person say if they have anything else to add to that list. Ron?
Yeah. My rule was, I don't let cancer rule. I ruled it. Dr. Albertini knows that when it comes to my fishing, I put the cancer on the side and I went fishing. So that's the main thing. It all starts up in the mind. You've got to have positive all the way. Don't give up. If a roadblock comes up, go to the next step. That's what I did.
Kirsty?
So 100% agree with what my new friends here said. And for me, I thought about what would be in alignment with who I am to make me feel better. I love to dress up. So I asked my husband if he would dress up for me every month when we went in for our immunotherapy visits. One of my favorite moments was when the nurse didn't tell Dr. Albertini that we were in costume, and he came in, I don't know what we were wearing, bless his heart. It was just
It was a
wonderful.
side effect of the treatment.
Just bringing some, clearly this is very serious. And for me, I was extremely lucky in the type and the response I had. And also just finding ways to bring joy in and sharing that with others.
Kathy? Then we'll open it up to the audience.
Just everything of, what you guys have said. I think it's really important to maintain a positive image. And if you do have questions, go to your doctor, find out answers. And my family has helped me a lot, and my friends. So I have all of them to thank.
Okay, great words of advice. Let's open it up both to the internet and to the audience here. So as before, just so indicate if you have a question to ask. And we can run a little over in this section. We've got a Q&A at the end, which is an overlap from the end of the morning. So we'll make a little bit later for this part, and then we can finish up with the other parts afterwards. So from the audience first.
I'll ask a question. So my role is to this is Ann, for everyone who's online. My role is to be oftentimes the first face for AIM at Melanoma. When people call and they're newly diagnosed and they're seeking information and connection. And what people will express is a sense of isolation, even if they are surrounded by people who love them, their family, their church community, their friends. And so talk a little bit about how you built a support system for you. How did you communicate with the people that you loved about how you needed to be supported?
Well, I started by telling my wife about it and she was pretty calm about it. She said, hey, find out what the best thing to do is and just do it. Do it really hard, work really hard at it, which fits in with one of the points I made. My friends at work and my colleagues at work were just great, and I told them about it, and they were supportive, helpful, and I tried to keep doing my job through the whole thing. When I was taking interferon, I just moved my camping pad and sleeping bag into my office because I needed more naps. And everybody knew that if Steve's door is shut and says he's napping, he's napping. Let him take his nap. So,
Great. Other questions from the audience? So the question was, how do they handle insurance problems? Do they encounter that? Did any of them encounter that? So if any of you encountered insurance problems, how did you handle it? I guess I'll rephrase the question.
I didn't have any personally, but I've heard that Gilda's Club has an incredible specialist there that deals with that, and their doors are open to everyone, any type of cancer, and they're really good at helping navigate that.
And I'll add, and also to talk with your doctors too, because I think oftentimes there's appeals and things at the provider level that can be added to the patients as well. So again, sometimes that can be helpful as well. Other questions from the audience?
Yeah, I'm a huge hippie at heart. And so when I got the lumps and bumps from the immunotherapy, I read a lot of books on natural ways to help them. And I don't know how much was mindset, how much was placebo, but for me, it was peace of mind. I'm taking this chemical and this drug that's really incredible. And because I didn't have it to the point of being so severe that I needed medication, I was able to use alternative things on my skin that helped. And for me, part of my job is, talking about mindset and positive speaking. So one thing I did when I was pregnant and having a scan that was very, very loud was just saying affirmations in my head, about love and healing with my baby and imagining hearts going around. And it sounds silly, but it's somewhat soothing, just putting that out there. And huge advocate of meditation.
And with the questions from the internet, I guess I don't see those here. So I don't know if you were getting any questions from the internet or not. Okay. Other audience questions? I mean, one I'll ask is how did you stay positive for any of you? Clearly, each of you had challenging situations as you described. How do you stay positive?
I have to say, when everything started, it was very hard to stay positive. I was always ready for that shoe to fall. I think sometimes the longer or the farther it gets out, just a little bit easier. And I know eventually I'm gonna have to have a scan. And I try to save it all up and, have a little panicky at that point and try to live my life.
Other questions from the audience?
We did have.
Your initial lesion of concern that ended up being melanoma, did you find the initial lesion of concern and went in, or did someone else find it on you and then you went in?
Answer this one. My mother was a nurse and I had a mole here, a beige mole that had a little dark spot on it. She kept telling me, son, you better get in and check that out. You probably got melanoma. Well, I kept putting it off. And then one day she come in, no, son, you gotta go in. That's just not right. So that's what I did. I went down to the VA and I had the scoop, and I probably would have went in when she first started about a year before. I probably would have been stage 1 and ended up being stage 2. It helps have people coax you a little bit.
For me, I could also visibly see, I called it a volcano on the side of my jawline, and it was changing, shifting. And it took me also a long while before I got it checked, but it was noticeably visible.
What many struggle with is the challenge in terms of the outcome with various imaging to look for recurrence and the stress and anxiety associated with doctor's appointments and imaging and trying to find that out. How do you deal with the anxiety and stress of upcoming imaging and having to see someone like Dr. Mon or myself? How do you deal with the stress and anxiety associated with imaging that might show recurrence and going to doctor's appointments to go over that imaging result?
With every image, every time you go in for an image, you're thinking, uh-oh, this one's the one where there's going to turn out to be a cantaloupe in there, cantaloupe sized thing. And so you do worry about it, but Dr. Albertini calls as quickly as he gets the data. So that removes quite a bit of anxiety. And now they post it on my chart pretty quickly as well. And I don't know if I'm answering your question, but I'd say just quick information is. Another thing that I tried to do and was successful in doing, and maybe it's just because I'm absent-minded and don't pay attention to enough things, is I just dug into jobs I really like doing. Activities with friends, people I like, activities with family that I like. I just jumped into those, and somehow melanoma kind of fell into the background while I was doing things I liked.
Yeah, I like that. I had the stage 4 melanoma and I had the epi done at Eau Claire. And then I transferred back to Dr. Albertini here. And the imaging that was about the only time I really wanted to see the imaging, because the cancer was disappearing. I was coming every 3 months now. I just couldn't wait to see getting smaller and smaller and gone. Imaging, it does good work.
Okay, any questions from the internet? And last call for our audience. Well, I think a round of applause is appropriate for us.